tonight you are also working here in Los Angeles with the African Communities Health Coalition. So you see both local issues, but also in a larger global context. So could you please tell the audience about your African-centered approach to mental health care and service delivery, and what are the most urgent concerns you're seeing now here with your community in Los Angeles?
Thank you. At first, I just wanted to brief you guys after to this film. I feel like it's really important to be here, to be the voice, and so thank you to invite me for this. This is more than one can imagine what's going on everywhere, just being a woman. Doesn't matter which continent and which country and ethnicity. Second, ours is a little bit different when I say ours. I'm the first immigrant coming from Ethiopia, so here we don't have anything that advocate and be the voice for the migrant from Africa. As you see, most of the issues tends to be in Africa. So that's how we founded this organization, mainly in response to mental health issue within African community and also Caribbean diaspora. From that on, we just move forward. We have different services. One of the services, immigration is one of the issues that leads to mental illness. The other one is gender-based violence within the community. That's where we focus. And so happened we're very courageous group. I have my chair here at the Karim from South Africa. I'm a vice chair of the group, the task force called FGM Task Force, the Greater Los Angeles FGM. That's because FGM, as you saw it in the film, it's a taboo. Not only that, here in the United States, there's misunderstanding what it means coming from Africa or from any other cultural background. FGM tends to be a criminal code, like a penal code for if you would anyone practice here in the United States. There's going to be a punishment, 10 years imprisonment, right? So because of that, we had to get involved. We had to provide prevention before punishment. And that's why we came out to be a group, this task force. We've been dealing with Department of Homeland Security. I say that because usually they are the agents from the entrance, the airport, pulling people coming most likely hijab, Muslim countries or Africa. Sometimes it could be negative profiling, pull them on the side, asking the girls if they have been circumcised or cut. And this is like U.S. citizens when they go back home for a holiday. So they ask us to do this kind of, who's the practice, but we advocate, be the voice. I'm a woman, why would I even have to be a choice between the culture I live with for how many years? Which the film show, to be a woman in Africa or some other country who does practice, she has no choice but being that little girl. She's not going to get married and she's not going to get no money. So that's a choice I had to live with. So don't tell me how to live my life just because I came from the outside and you're going to jail me or something. That's how we step up and start asking prevention education instead of punishment. Since then, we work so hard closely with religious groups such as mosques and churches, community leaders, and also we have given to Department of Homeland Security agents such as the airport officers how to approach and from cultural perspective. Matter of fact, we are scheduled next week, right? On the 15th, we're going to be educating another group agencies. So to say that, we not only focus on FGM, there's early marriage issues. Some of you practice, your experiences how affect a woman or young girl to marry someone who doesn't know not only that age level, physically and mentally. The other one is human trafficking. There's sex slaves in here in our city. Those are the kind of things we advocate, be the voice. We partner with a lot of organizations and public and private agencies. So the work is long way, but if we change one thing out of anything, that's a better way to do it. There's a lot of policy you have to work, has to be implemented in some countries like Kenya, Ethiopia, for example, FGM, but we do have others can't even talk about the issue of gender-based violence, including FGM and early marriage. Those are the kind of advocacy we're working on.
And Tracy, you are also doing this work within gender health. So as a global organization based in the United States, with a commitment to advancing sexual and reproductive health and rights and gender equality, how do you see the current U.S. policy impacting the rest of the world?
All right, Tracy, I heard your question.
Yes.
Before I answer it, I think it's important for folks to know that Tracy Destragos is also a filmmaker, and with our friend and colleague and participant Francine Coito made the movie about Plan C, which is one of the major efforts to make medication abortion available by mail to people in the U.S., including in red states. And on Friday, they are flying to New York because they've been nominated for a Webby Award for Plan C. So let's just pause on this. Okay, but I did hear your question.
Yes.
So, it's interesting because the films we saw, some took place in Africa, some were filmed in the US, including here in Los Angeles. But we see each of these issues in every place. And Gender Health works to improve the respect given to women, to pregnant people during maternity care. We saw the first film about maternal mortality and the challenges of just prenatal care and delivery in a number of countries in Africa. We work to make the care more respectful, safer. I've been traveling to dozens of countries in Africa for 29 years, and there are plenty of hospitals across the continent where I would have been happy to birth my babies. There are also places where it's incredibly dangerous to be pregnant at any stage of pregnancy. And what we aim to do is to lift that up, improve the quality of care, so no one who is birthing is putting themselves at risk. We work on menstrual health and destigmatizing periods and making sure that people have access to period products. One of our partners is a young woman who pretty much single-handedly has made sure that women who are in jails and prisons in Abidjan, in Côte d'Ivoire, West Africa, have access to period products. And before she started that effort, they didn't. Each thing we do, whether we're working to address female genital cutting, we're doing it with our local partners. The we here, I'm sitting here, I grew up just south of here in Orange County. I'm a very small part of the we. 85% of our staff are based in the countries where we work. Our staff in Ethiopia are Ethiopian, our staff in Nigeria are Nigerian. So the we is people of and from and within these cultures doing this work with our local partners and governments, medical professionals. And one of the things that makes their work is the great partnerships we can have across the issues we're dealing with and across organizations. One of the things that makes their work harder is when U.S. foreign policy and U.S. policy goes off the rails. The Dobbs decision, the Supreme Court decision that overturned Roe v. Wade and removed our theoretical constitutional right to abortion in this country, is perceived in many places around the world as foreign policy. I mean, it's in the news, so it must have something to do with the rest of the world. We know it's domestic policy, but there's enormous conflation between what actually happens in the US and what really is relevant in other places. And some of that is because a lot of foreign assistance funding comes from the US, and some of that is because a lot of the funding for the opposition comes from the US. The anti-choice movement, the anti-LGBTQ movement, the anti-sex education movement are all intricately connected and very much US funded. So, we like to say, like, nothing about us without us. we also have to recognize that in the US, sometimes what we're doing as a country, not those of us here or those of you here, but what our country does is often at odds with what we say our values are, and really the commitment that I know everyone in this room holds to respect the rights to health, access, equality for all people. So we're quite a woven web, and thrilled to be here with folks who are working on really important pieces of that web.